So I'm presenting today a sub-study from the DREAMM-5 protocol, and this is actually a very interesting protocol that has a number of components, and the idea is we're using Belantamab, which is an antibody-drug conjugate directed against BCMA, and we're pairing it with various agents which have different or complementary mechanisms of action, trying to find a signal for something that improves response rate and efficacy. So the sub-study I'm presenting involves the combination of Belantamab with what's called an aICOS agonist. So aICOS stands for inducible co-stimulatory molecule receptor of T cells, and what this is felt to be is a member of the CD28 Ig receptor family, which is very important for T cell proliferation and activation, and it is expressed on CD4 and CD8 cells. One of the concerns in myeloma is T cells can be exhausted, so it makes sense to use an agonist in this case along with Belantamab. So I'm going to present some preliminary data on 25 patients who received the combination of Belantamab with aICOS the aICOS agonist at various doses. And what we were able to show is that for the 25 patient group, the overall response rate was 52%. And of those responding, 57% had at least a very good partial response or better. There were no additional safety signals with a combination over Belantamab by itself. And actually, the incidence of keratopathy was about 44%, which is lower than seen in DREAMM-2. And in addition, the incidence of grade 3/4 keratopathy was only about 20%. This is a steroid-free regimen, so that makes it more patient-friendly. And I think these are very interesting preliminary data. This is sort of corneal irritation of the corneal epithelium, and that's been an issue. It can occur in up to 75% of patients, and typically it does respond to dose holds and dose reductions. So most of the patients who develop it can get retreated with Belantamab, but it does mean that, at least for the FDA approval, that patients have to be seen on a regular basis by an ophthalmologist, and in the DREAMM-5 study we had that stipulation as well.